If a single mineral could help you lower blood pressure, stabilize your heart rhythm, reduce anxiety, and prevent a heart attack, would you want to know what it is? Why are millions of Americans over 60 deficient in this mineral without realizing it? And why can a standard blood test completely miss it? In this video, you will discover what most doctors never tell you, how magnesium silently protects your heart, and why magnesium deficiency can destroy your health even when you feel fine. I will guide you to understand the essential role of magnesium, why our bodies are so prone to deficiency, the warning signs you should never ignore, and most importantly, how to supplement magnesium the right way to prevent dangerous medical events. High blood pressure does not cause pain and does not bring immediate discomfort, yet it is one of the silent causes leading to serious events such as heart attacks. In the United States, someone suffers a heart attack every 40 seconds. Most of them are unaware that their bodies are lacking a critical factor needed to keep the cardiovascular system stable. That factor is magnesium, an essential mineral involved in more than 300 biochemical reactions in the body, including vital functions such as regulating heart rhythm, relaxing blood vessels, controlling blood pressure, and stabilizing the nervous system. But why are so many people deficient in magnesium? Why, even with what seems like an adequate diet, are we still at risk? And could this deficiency be linked to sudden anxiety, unexplained sleepless nights, or a racing heartbeat while at rest? These questions will be answered as we look deeper into how magnesium works in the body, its specific effects on the heart and blood vessels, and how we can detect, prevent, and correct deficiencies before it is too late. What you are about to learn is not just scientific information, but a foundation for taking proactive steps to protect your heart naturally, safely, and effectively. Magnesium functions as a natural regulator for the entire cardiovascular system. When magnesium levels are sufficient, blood vessels remain flexible and can dilate properly, reducing pressure on the arterial walls and naturally lowering blood pressure. Magnesium also plays a key role in transmitting electrical signals in the heart muscle, helping maintain a steady heartbeat and preventing dangerous rhythm disorders such as atrial fibrillation. People with low magnesium levels are more prone to arrhythmias, especially during stress or prolonged sleep deprivation, yet most do not recognize this until serious complications occur. A major issue is that most of the body's magnesium is stored inside cells, not in the bloodstream, which means standard blood tests often fail to detect deficiencies. This leads many people to feel reassured by normal results, when in fact critical organs such as the heart are severely lacking. The problem becomes even more serious in adults over 60, as the body's ability to absorb magnesium from food decreases significantly due to aging, as well as from the side effects of commonly used medications such as diuretics, proton pump inhibitors, and blood sugar-lowering drugs. Factors that may seem unrelated often become the hidden reasons why magnesium levels gradually decline over time. When magnesium is deficient, the body begins to send warning signals, but most of the time these are ignored or mistaken for other problems. Persistent fatigue, even after rest, nighttime leg cramps, unexplained anxiety, difficulty sleeping, irregular rapid heartbeat, or recurring mild headaches may all be early signs of magnesium deficiency. In older adults, these symptoms are often attributed to aging or stress, without realizing that the root cause could be a mineral missing from the daily diet. Magnesium is also linked to silent inflammation within the artery walls, a factor that raises the risk of plaque buildup and blood clots, the two main triggers of arterial blockage leading to heart attack. This process develops quietly, without immediate pain, but the consequences are severe if not recognized and treated in time. With adequate magnesium, artery walls are protected from sudden spasms, blood flow remains stable, and the heart does not need to overwork. In contrast, when magnesium is lacking, the sympathetic nervous system becomes overactive. Blood vessels constrict abnormally, blood pressure rises uncontrollably, and the heart is forced to pump harder, increasing the risk of heart muscle damage, especially in the presence of risk factors like diabetes, high cholesterol, or smoking. The older you get, the more clearly magnesium deficiency affects heart function, yet it often goes unnoticed or underestimated. Another concern is that the modern diet is steadily depleting natural magnesium stores. Processed foods, refined sugar, industrial oils, and sedentary living have caused magnesium intake to drop sharply compared to previous generations. Today's farm soil is also less nutrient-rich due to prolonged industrial farming, which means fruits and vegetables contain less magnesium even if they appear fresh. This means that even if you think you are eating a healthy diet, you may still not be getting enough magnesium for optimal heart function. In addition, habits such as frequent consumption of coffee, alcohol, or soda, along with long-term use of diuretics, further increase the loss of magnesium beyond what the body needs. To prevent magnesium deficiency, it is important to prioritize foods naturally rich in this mineral, such as dark leafy greens, beans, pumpkin seeds, sunflower seeds, almonds, whole grains, and ocean fish. These are sustainable sources that not only support cardiovascular health, but also improve nervous system function and lower the risk of insomnia. However, in older adults or those with chronic conditions, diet alone may not be enough to restore ideal magnesium levels, especially when absorption is already reduced. In such cases, magnesium supplementation should be considered under medical guidance. The form most highly recommended is magnesium glycinate because it is well absorbed, causes fewer digestive side effects, and is relatively safe for long-term use. Choosing the right type of magnesium is key to maximizing benefits and avoiding unwanted risks. Among the various forms available, magnesium glycinate is considered optimal since it does not act as a strong laxative like magnesium oxide or citrate, while showing clear effects in calming the nervous system, improving sleep, and stabilizing blood pressure. For older adults, dividing the daily magnesium dose into 2 smaller portions can improve absorption and reduce gastrointestinal discomfort. It is also important to be cautious if you have kidney disease or are taking blood pressure medication or diuretics, and to consult your doctor before starting supplementation to ensure safety. Beyond supplementation, maintaining a healthy lifestyle is essential for long-term protection of the heart and brain. This includes a diet high in fiber, low in refined sugar, limited in salt and saturated fat, along with daily light activity such as walking, deep breathing, or relaxation practices like yoga and Tai Chi. These simple habits, combined with maintaining adequate magnesium levels, can make a major difference in preventing serious conditions such as hypertension, arrhythmias, and heart failure. Your body does not demand complicated measures. What it requires is the right understanding, early action, and consistent practice. Do not wait until the first heart attack strikes to start caring about what could have been prevented years earlier. Can magnesium replace heart medications? Understanding this correctly is essential to protecting your heart safely and scientifically. In recent years, many people have turned to natural solutions to manage blood pressure and heart rhythm. Among these, magnesium has gained attention as a mineral with important cardiovascular benefits. However, its popularity has also led some to misunderstand or misuse it as a complete substitute for prescribed medications. The question is, how effective is magnesium really? Can it be compared with blood pressure drugs or antiarrhythmic medications? And when is magnesium alone enough, and when must it be combined with standard medical treatment? First, it is important to understand that magnesium is not a medication. It is an essential micronutrient involved in more than 300 biochemical reactions in the body, including regulating vascular tone, nerve signaling, cardiac muscle contraction, and heart rhythm control. Studies show that people with adequate magnesium levels in blood and tissues generally have lower blood pressure, a lower risk of arrhythmia, and a reduced rate of cardiovascular mortality. However, these effects come primarily from prevention and supporting physiological stability, not from rapid intervention the way prescription drugs work. For blood pressure medications such as ACE inhibitors, beta blockers, or diuretics, the mechanisms are very direct, acting on the vascular system and the heart to lower blood pressure quickly within a short time. Magnesium, by contrast, provides mild vasodilation, improves arterial elasticity, and reduces inflammation, but the blood pressure-lowering effect is slower and milder. Therefore, if you have chronic high blood pressure, especially levels above 140/90 mmHg, magnesium should only be seen as supportive, not as a replacement for prescribed treatment. The same principle applies to antiarrhythmic drugs such as amiodarone, flecainide, or digoxin, which directly regulate electrical conduction in the heart to stabilize rhythm and prevent atrial fibrillation or ventricular tachycardia. Magnesium does help regulate calcium and potassium flow across cardiac cell membranes, indirectly supporting electrical stability, but it is not strong enough to control severe arrhythmias. In mild cases, such as palpitations related to stress, insomnia, or autonomic dysfunction, magnesium supplementation can noticeably reduce symptoms. But in conditions like atrial fibrillation, ventricular fibrillation, or acute heart block, magnesium cannot replace specialist medication. In summary, magnesium is a valuable ally in cardiovascular prevention and support, but it is not a substitute for prescribed therapies. Its role is complementary, not curative, and the safest approach is to use magnesium alongside, not instead of, evidence-based medical treatment. One important point to remember is that many people stop taking their prescribed medications once their blood pressure appears stable after a few weeks of magnesium supplementation. This is a dangerous mistake, because the immediate effect usually comes from the prescribed drugs, while magnesium only provides long-term foundational support. Stopping medication suddenly can cause rebound effects, leading to a sharp rise in blood pressure, irregular heartbeat, or even more serious complications. For this reason, any decision to adjust dosage or change medications must come directly from a cardiologist. In summary, magnesium is an important part of cardiovascular prevention and support, but it cannot and should not replace prescription medications if you are being treated for high blood pressure or arrhythmia. The best approach is to use magnesium as a strong nutritional foundation that enhances the effectiveness of medication, reduces side effects, and promotes long-term stability of the cardiovascular system. By understanding the proper role of each factor, you can truly manage your heart health safely and sustainably. Magnesium is an essential mineral that participates in more than 300 biochemical reactions in the body, many of which are directly tied to nervous system activity and the way the body responds to stress. When the body faces mental or physical pressure, the sympathetic nervous system is activated, releasing stress hormones such as cortisol and adrenaline. Magnesium acts as a natural regulator, reducing the intensity of this response by controlling nerve signal transmission and stabilizing the hypothalamic-pituitary-adrenal axis. One key mechanism is magnesium's support of GABA receptors, which are inhibitory neurotransmitters that calm the brain and promote relaxation. When magnesium is deficient, GABA receptors function less effectively, leading to increased nerve excitability and making a person more prone to anxiety, chronic stress, and insomnia. Magnesium also helps regulate serotonin levels, a neurotransmitter associated with mood balance and feelings of well-being. Clinical studies show that supplementation with magnesium, especially well-absorbed forms such as magnesium glycinate or citrate, can significantly reduce symptoms of anxiety and mild to moderate depression while also improving sleep quality in adults. The effects of magnesium on stress and anxiety go beyond the nervous system and are closely tied to cardiovascular health. Chronic stress often raises blood pressure and heart rate, increasing strain on blood vessels and contributing to atherosclerosis. Magnesium helps relax vascular smooth muscle, improves blood flow, and reduces inflammation, thereby limiting the harmful impact of long-term stress on the circulatory system. Another important factor is that magnesium deficiency often occurs alongside conditions such as insulin resistance, metabolic syndrome, and arrhythmias, all of which can be worsened by stress. Adequate magnesium intake improves insulin sensitivity, lowers CRP and other inflammatory markers, and provides a healthier physiological foundation for coping with stress. Magnesium supplementation from dietary sources or supplements should always be guided by a healthcare professional to ensure the right form and dosage, especially for individuals with chronic conditions or those taking medications that affect magnesium metabolism. With its dual role in calming the nervous system and protecting the cardiovascular system, magnesium is a key factor in managing chronic stress and anxiety, improving quality of life, and reducing the long-term risk of cardiovascular disease. Quick test. Are you magnesium deficient without knowing it? Magnesium deficiency is one of the most common yet easily overlooked conditions, especially in older adults, people with chronic illnesses, or those on long-term medications. The danger is that many symptoms of magnesium deficiency resemble stress, insomnia, or ordinary fatigue, making them easy to mistake. Below is a quick 10-question test. Answer yes or no for each. Each yes counts as 1 point. Add up your score to find out your risk of magnesium deficiency. Question 1. Do you often experience nighttime leg cramps, numbness in your hands or feet, or twitching of the eyelids? Question 2. Do you sometimes feel palpitations, rapid heartbeat, or pounding in the chest without a clear reason? Question 3. Do you have trouble sleeping, such as difficulty falling asleep, shallow sleep, or waking up at 2 to 3 a.m.? Question 4. Do you frequently feel anxious, irritable, or restless without cause? Question 5. Do you drink alcohol regularly, or have you consumed an average of more than 3 drinks per week for an extended period? Question 6. Are you taking diuretics, proton pump inhibitors such as omeprazole, insulin, corticosteroids, or long-term antibiotics? Question 7. Do you have chronic conditions such as type 2 diabetes, high blood pressure, heart disease, kidney disease, or irritable bowel syndrome? Question 8. Do you often suffer from constipation or poor digestion even though you eat enough fiber? Question 9. Do you rarely eat magnesium-rich foods such as leafy greens, nuts, pumpkin seeds, beans, whole grains, or dark cacao? Question 10. Have you had a blood test that showed normal magnesium levels, but you still experience the symptoms above? Scoring. 0 to 2 points. Low risk. You may be getting enough magnesium from your diet, but you should still maintain a balanced meal plan and have regular health checkups. 3 to 5 points. Moderate risk. You may have mild magnesium deficiency in your cells even if blood tests look normal. Increase magnesium-rich foods and consider further testing if symptoms persist. 6 points or more. High risk. You should consult your doctor promptly. You may need intracellular magnesium testing or supplementation with well-absorbed forms such as magnesium glycinate or magnesium citrate. Important note. This test does not replace medical diagnosis, but it is a valuable early warning tool, especially for people over 50, those being treated for heart disease, or anyone with a lifestyle that increases mineral loss. If you score 6 or higher, do not ignore it. Magnesium deficiency does not just cause fatigue. It may be the hidden cause of high blood pressure, arrhythmia, and silent stroke. How to check if your diet provides enough magnesium. A magnesium-rich diet should not be based on guesswork. It needs to be assessed by looking at how often you eat key food groups. Here is a simple guide you can use for self-checking. Question 1. Do you eat at least 1 serving of dark leafy greens, such as spinach, amaranth, collard greens, or Malabar spinach every day? Question 2. Do you eat nuts, such as pumpkin seeds, almonds, sunflower seeds, or cashews at least 3 times a week? Question 3. In the past week, have you eaten legumes such as black beans, lentils, red beans, or soybeans at least 3 times? Question 4. Do you eat whole grains such as brown rice, oats, or whole wheat bread instead of white rice or white bread at least 4 times a week? Question 5. Do you drink plant-based milk or unsweetened milk fortified with magnesium, such as almond milk or soy milk, at least 3 times a week? Question 6. Do you consume pure cacao or dark chocolate, over 70%, at least twice a week? Question 7. Do you eat ocean fish, such as salmon, mackerel, sardines, or tuna, at least twice a week? Scoring.
6-7 points, your diet is rich in magnesium and very beneficial for heart health. 4-5 points, your magnesium intake is moderate, but you should add more leafy greens and nuts. Below 4 points, you are at high risk of deficiency and should adjust your diet or consider magnesium supplements under medical guidance. Remember, eating consistently and with variety is always a more sustainable foundation than relying only on supplements. Positive health changes do not always require complex therapies or expensive medications. Sometimes adjusting one foundational factor, such as your magnesium levels, can bring noticeable improvements in blood pressure, sleep quality, and heart rhythm stability. This is especially true for people over 60, when aging makes the body more vulnerable to imbalance and reduces the ability of organs to regulate themselves. Being proactive with magnesium intake through diet and paying attention to even the smallest signs of deficiency can deliver long-term benefits that many do not expect.
A body with adequate magnesium is not only stronger, but also responds better to stress, recovers faster after illness, and lowers the risk of dangerous cardiovascular complications. On the other hand, a body lacking magnesium is more likely to become overloaded, fatigued, and unable to regulate heart rhythm, blood pressure, and sleep. These issues build up over time and may eventually appear as a sudden heart attack or an unanticipated stroke. Delaying recognition and correction of magnesium deficiency is not just a missed opportunity for protection, it exposes you to risks that can be prevented with simple, practical steps starting today. If you have ever experienced unexplained rapid heartbeat, insomnia despite feeling exhausted, or nighttime anxiety that feels uncontrollable, these may not only be signs of aging or stress, but also warnings from a cardiovascular system under strain from magnesium deficiency. This is something most people overlook and often only discover after a major event has already occurred. Instead of waiting for the worst to happen, you can take control now by ensuring your body has sufficient and stable magnesium every day. This does not require high cost or drastic lifestyle changes, yet it can create powerful and lasting benefits for your health. Start by reviewing your diet, adding magnesium-rich foods into your daily meals, and, if needed, consult a healthcare professional to choose the right supplement form for your personal condition. Do not underestimate the power of small steps, because they are often the key to major health improvements. Think of magnesium as a silent shield protecting your heart and blood vessels, an unseen but essential ally in your journey toward long-term health. Every proactive step you take today can prevent regret tomorrow. Your heart and brain deserve to be cared for with knowledge and timely action. You have stayed with me until the end of this video, which shows that you truly care about the health of your heart and brain. Now you know how important magnesium is, how to recognize deficiency, and how to supplement it properly. But the information will mean nothing if you do not start acting today. Begin with the smallest changes, choosing better foods at the table, paying closer attention to symptoms you may have ignored, and, when necessary, supplementing magnesium in a safe, consistent, and evidence-based way. Your heart is waiting for you to protect it before it is too late. Every decision you make today will shape your health for years to come. Be proactive, do not delay, and never overlook the role of a mineral that may seem simple but could save your life. If you found this content useful, subscribe to the channel so you do not miss other vital health information. Each week, I will share reliable, clear, and practical knowledge to help you live healthier every day. Thank you for watching, and I will see you in the next video.